As a CA-1, you'll get plenty of opportunity to do spinals. You'll do them as a primary anesthetic for lower extremity joint surgeries, as well as for postoperative pain control, like for big abdominal surgeries. So we'll walk through what you need to grab and how to set up your kit. All right, so what are you going to need to grab for your spinal? We've got your spinal kit. Some consultants want you to mark the crests and mark the spaces, so I'd go ahead and grab a skin marker, ChlorPrep stick, sterile gloves in your size, some sort of spinal needle. I have 3 examples here. I'd probably ask your consultant about it. It's a good teaching topic. So this is Whitaker 22 if you have like an old guy getting a hip or a knee replaced. This is a Whitaker 25 gauge, so a little bit smaller, maybe for like a younger patient. It's a little flimsier though than the 22. Pen can, this is 24 gauge. It also comes with an introducer at the end of it. If you have no clue what to grab, I would just grab a few and have them ready and talk to your consultant about it. And then whatever you're gonna inject in your intrathecal space, so that might be a local anesthetic. If you're doing it just for pain control, like after surgery, that'd be an intrathecal opioid, like Dilaudid, which you can find in your Pyxis. The local anesthetic will be with your block supplies. So I'm going to walk through how to set up a spinal tray. In this case, I grabbed the Whitaker 22 needle and some bupivacaine 0.5%. So this might be for like if you're doing a spinal for like a hip or a knee replacement. So I'm going to grab all my stuff. I might go ahead and take a feel of the patient's back and mark where I think some good spaces are, and then go ahead and prep their back and then set up my tray. Or if I have someone helping me, I might have them prep while I set up my tray. So before you get started, probably good to take off any jewelry that you have on. So like watches and rings, and then don't forget to do a little bit of hand hygiene here. All right. So I'm gonna open up my tray. Then I'm going to drop my spinal needle onto my tray. I also need to get my local in that well right there. So I like to use my hemostat that I keep with me. Just pour all of that into the well. And then you can get your gloves on. So I'm going to move some stuff out of the way here. So our local's in there. This kit comes with a syringe that's like a slip tip syringe instead of that lure lock syringe. So when you're doing a spinal, you want something with a tip like this, not one that kind of locks into place. So talk with your consultant about exactly how much local you're gonna be using. In this case, I'm using bupivacaine 0.5% and let's say 2.2 cc's. I'll have this ready to go. Just like with peripheral nerve blocks, you're gonna wanna do a skin wheel to numb the skin for that spinal injection. So I'm gonna use the lidocaine that comes with the kit. And it's in a glass vial here, so you're gonna wanna use a filter straw, or you can use this needle, which also has a filter in it. One side note, if you're using mepivacaine, you can use that in your skin wheel. It's pretty similar to lidocaine. And then you can just draw it up out of your local well here instead of having to use that lidocaine. So I'm gonna put this 25 gauge on for the skin wheel, have that ready to go. And then I also make sure I have my, whatever spinal needle I'm using ready to go as well. At this point, I'm gonna grab my drape, make sure we've done a good timeout, make sure the patient's prepped. You'll go ahead and put this on the patient's back. You'll do your skin wheel. You'll successfully get your spinal right away, and then you'll inject your local there. One note, so this kit comes with an introducer. So if you're using something smaller than this Whitaker 22, you can use this introducer that comes with the kit. So what medications are you actually going to be using in your spinal? If it's you're using it as a primary anesthetic, like for lower extremity surgeries, like your hips and your knees, you'll use local anesthetic. Usually we use either mepivacaine or bupivacaine. These numbers I got directly off our department website. So for the mepivacaine, it's 60 to 80 milligrams, and that would equate to 3 to 4 cc's of 2%. So usually we'll do like 3.5 or 3.6 cc's of that. That I'd use more for like a routine primary hip, primary knee, and I know the room is moving quickly. That's what you're going to reach for. If it's a longer surgery or revision, or anyone on the surgical team is like, hey, this might last a little longer than we want to do, then I'd more likely reach for bupivacaine. We usually use between 2 and 3 cc's of 0.5%. So both of these can be found with all of your other block supplies. If your spinal is for post-op pain control rather than as your anesthetic, so like for big abdominal cases or the renal transplants we do, we'll use Dilaudid for those. Usually 100 to 200 micrograms, and that's 1 to 2 cc's of a vial you can find in your Pyxis, but I've seen some people do 300. So this you can pour directly into the well just like you do with your local anesthetic, but I've seen other people, you can have like the consultant hold it upside down and you draw it up sterilely, so either way. This is all pretty basic, bare bones. Like when you get on OB, you'll be throwing all sorts of stuff in your spinal, and you'll read about different additives like other opioids and epinephrine to put in your spinals. But for stuff that you're doing as a CA-1, this is pretty routine.